The Saskatchewan Health Authority Enterprise Risk Management Policy. Risk is any situation that prevents the Saskatchewan Health Authority, the SHA, from achieving its goals or objectives, and it may result in danger, harm, or loss. A hazard is something that has the potential to harm you. A risk, however, is the likelihood of a hazard causing harm. When thinking about risk, we must ask ourselves, what could go wrong? Risk management requires us to identify, assess, manage, monitor, and communicate. To identify risk, gather information, review data about current state and past events, use expert judgment, talk to stakeholders, conduct team brainstorming sessions, consult experts in the area, use inquiry techniques, find root causes, analyze strengths, weaknesses, opportunities, and threats. To assess risk, consider how likely the risk is, and consider the impact if the risk occurred. Risk equals likelihood times impact. Enterprise risk management addresses organizational risks from all sources, and it is a continuous, proactive, systemic process that improves decision-making. The treatment of risk includes a number of options: reduce, accept, avoid, or transfer. The board, executive leadership team, and senior leadership team handle more strategic risks, whereas managers, medical department heads, and frontline providers deal more with operational risks. Everyone must manage risk within the scope of their responsibility. We must all be able to identify and assess risk, manage, monitor, and communicate risk, and escalate and elevate risk when it cannot be managed within one's role. We escalate risk to someone else to ensure the risk is managed appropriately. When making decisions, consider the risks. Managing risk is everyone's responsibility. If you have any questions, we encourage you to talk to your manager or supervisor. Staff are required to comply with SHA policies and procedures and are responsible to familiarize themselves with the policy in its entirety. Healthy people, healthy Saskatchewan.